Hello, my name is Shirley Cohen-Mekelburg, and I'm an inflammatory bowel disease specialist at the University of Michigan. Welcome to the IBD School 300 series. In this video, IBD School 327, we will be talking about the things you should know regarding narcotics and inflammatory bowel disease. Patients with inflammatory bowel disease often suffer from chronic abdominal pain, as well as other pains such as joint pain. Pain is complicated in that the perception of pain differs from person to person. Some patients have active inflammation but don't perceive any pain, while others have their inflammation under good control but have the perception of pain due to mild inflammation or other causes that are not inflammatory in nature. Narcotics, also known as opiates or painkillers, are strong medications that have historically been used to treat severe pain. Narcotics can be divided into two main classifications: legal opiates, which are the narcotics prescribed by a doctor, and illegal opiates, which include heroin and opium, but also prescription opiates that are used either not as they were directed by a doctor or without a doctor's prescription. Opiates have been in the news a lot lately due to a dramatic rise in opiate-related deaths. These deaths are commonly due to overdose, whether intentional or in most cases not. When we think of opiates, we think of their strong addictive potential. Studies have shown us that receiving just one prescription for opiates can start a person on the path to opiate addiction, which is a very hard addiction to resolve. Opiate use is on the rise in the United States. 80% of the world's opiates are consumed in the US alone. As the use of opiates in the country grows, we see a similar rise in our IBD patients, which is why it is important to consider that while opiates might be used in the setting of an acute illness, such as undergoing a surgery, we know that the complications of chronic or persistent opiate use does outweigh any potential benefits. And in the long term, as a result of tolerance, opiates are not effective in treating chronic pain. In the setting of inflammatory bowel disease specifically, the main side effects of opiates include nausea, constipation, euphoria, sedation, and respiratory depression. In the setting of inflammatory bowel disease, we also worry that opiates can induce or potentiate toxic megacolon. Toxic megacolon is a condition where a patient gets life-threatening dilation of the bowels. We also know that opiates can cause narcotic bowel syndrome, which is a syndrome where patients sense more pain with increasing doses of opiates. We know that in IBD, opiates have actually been shown to lead to more emergency room visits, longer hospitalizations, and if a patient receives opiates while in the hospital, they are more likely to have a longer length of stay than they would otherwise. We also have data that suggests that opiate use can contribute to a higher likelihood of death for inflammatory bowel disease patients, particularly in Crohn's disease. In conclusion, pain, whether inflammatory or non-inflammatory, needs to be addressed and treated. However, the best way to treat pain is by addressing the underlying problem, whereas opiates mask pain rather than target any particular problem. I'm Shirley Cohen-Mekelburg. Thank you for watching IBD School 327.